Going to want to hear this, but it needs to be said. You can't gargle and hum your way out of an autonomic nervous system problem. I know there are a lot of blogs and articles and YouTube videos that talk about using humming and gargling as a way to stimulate and tone your vagus nerve, but it's really not a robust strategy or a reliable strategy in order to make a person healthier when they're having an autonomic problem. And while it's true that gargling and humming do technically use your vagus nerve, but so do things like eating and drinking and sleeping, but those things aren't necessarily helpful for treating someone's stress issue either. Plus, there are just much more robust ways to stimulate the vagus nerve, including electrical stimulation. You could do slow paced breathing exercises, which I'm a big fan of. And you could also do things like the mammalian dive reflex, and even some carotid types of massage can actually stimulate the vagus nerve too. However, at best, these strategies can provide some short term relief to an acute stressor or acute situation, but they're not really a strategy for helping a patient get healthier over time. In fact, many autonomic disorders don't actually have anything to do with a broken vagus nerve. For many autonomic problems, we're actually trying to solve the fundamental problem of something called cerebral hypoperfusion. And in layman's terms, it just means that you're just not getting enough blood flow to deliver oxygen to the brain. And for patients with autonomic disorders, we have to try to figure out why that problem exists. For many patients, it comes down to a biochemical problem, meaning that they're having some inflammatory issue like an autoimmune disease. They might have some issues like an iron deficiency problem, or they might even have some blood sugar regulation issues that prevent the brain from working properly. For many of the patients that I see, it comes down to a brain signaling problem, especially when a patient's brain becomes hypersensitive to things like visual motion, vestibular motion, sound, or light. And for these patients, we could use rehab techniques in order to increase the brain's capacity to take on these types of stimulation, which means you have one less stressor on the nervous system. So you're actually increasing the brain's capacity to do work in its environment. And we've also learned from long COVID research showing that there might be a peripheral problem at the level of the muscle tissue and the mitochondria that exist in those muscles, where these broken, dysfunctional mitochondria are preventing the ability for the patient to use energy properly, which leads to things like chronic fatigue, brain fog, and chronic illness. So, for these vagal nerve exercises, we might be able to use them as a way to relax the mind and to alleviate some short term suffering. But for patients with dysautonomia, we really have to put effort into solving those metabolic and inflammatory problems. And then it's about being dedicated to doing the long work of improving the brain's capacity over time.